Dr. Mohammad Sazzad Rahman from Bangladesh. Assalamu alaikum to all. Um, Today is Ramadan time, so I will not take more time from you. Here I am to conduct a webinar about C-Root SP bioceramic sealer. It's a sealer from the C-Root company. Their motto is make Endo simple. But before I go to the C-Root SP bioceramic sealer, the main topic, I would like to discuss something about bioceramic sealer. So bioceramic based root canal sealers are considered and be an advantageous technology in endodontics, which have the ability to create bonds between the dentine and pore filling materials and is engineered to penetrate, fill, and seal main and lateral root canals. The composition of bioceramic sealers are calcium silicate, calcium phosphate monobasic, zirconium oxide, tantalum oxide, and thickening agent. The mechanism of bioceramic sealer. The mechanism of action of bioceramic sealer is the exact mechanism of bioceramic sealer based sealer bonding to root dentine is unknown. However, the following mechanisms have been suggested for calcium silicate-based sealers. First of all, diffusion of sealer particles into the dentinal tubules to produce mechanical interlocking bonds, infiltration of the sealer material content into the intratubular dentil resulting in the establishment of a mineral infiltration zone produced after denaturing the collagen fibers with a strong alkaline sealer. Partial reaction of phosphate with calcium silicate hydrogel and calcium hydroxide produced through the reaction of calcium silicates in the presence of the dentine moisture, resulting in the formation of hydroxyapatite along the mineral infiltration zone. Advantage of bioceramic sealers: good biocompatibility, good adhesion to dentine, good fusion with water, good flowability, radio-opaque, antibacterial, hardly shrinks or sponge after curing, no solubility in water. What are the disadvantages of bioceramic sealer? The first disadvantages of bioceramic sealer is presented a significantly higher incidence of extrusion than the resin-based sealer. Second one is difficulty in removing them from the root canal once they are set for later retreatment or post-placement. Now, composition of C-Root SP bioceramic sealer. This is strontium. Composition is strontium silicate, zirconium oxide, calcium phosphate, and calcium hydroxide. What are the advantages of strontium? Before I go through the sealer, we should know what is the advantages of strontium. Strontium and calcium have similar chemical properties. They are both alkaline material and antibacterial. Strontium can replace calcium in some physiological process, such as muscle contraction, blood clotting, and secretion of certain hormones. However, these processes are less intense than induction with calcium ions. Fourthly, strontium can also be incorporated into bone cells, which increases their density and reduces the risk of developing osteopenia and osteoporosis. Advantages of strontium are strontium and silicon, calcium, both elements accumulate in plasma and extracellular fluids, soft tissues, and the skeleton. The rate at which strontium is incorporated into bone is very similar to that at which calcium is incorporated. Strontium enhances the synthesis of bone matrix proteins, which takes place in osteoblast. It also inhibits the apoptosis of these cells, which promotes osteoblast survival. Background of strontium can substitute for calcium in growing bones and reduce vitamin D and calcium uptake in the body. Strontium regulate decrease bone resorption and increase bone formation. Strontium is incorporated in hydroxide apatite in bone by replacing a percent of calcium ions, which causes apparent increase in bone mineral density. Root SP, this Root company, they have lots of endodontic materials. But today I am here to only to describe about the Root SP bioceramic sealer. The roadmap of root canal sealer. The roadmap of root canal sealer, firstly, we used zinc oxide regional base sealer, and after that, the calcium hydroxide base sealer, glass ionomer base sealer, epoxy resin base sealer, silicone base sealer, calcium silicate bioceramic base sealer, and strontium silicate bioceramic base sealer. I've already used zirconium oxide, zinc oxide regional base sealer, calcium hydroxide base sealer. Epoxy resin based sealer, silicone resin sealer, and bioceramic sealer, which is calcium silicate based sealer. And nowadays, I am using strontium silicate bioceramic sealer. If we make them in three groups, the first group is outdated root canal sealers, are zinc oxide regional sealer, calcium hydroxide sealer, and glass ionomer sealer. What are the disadvantages of zinc oxide regional sealer? It shrinks on setting. Soluble can stain to structure, may negatively affect bonding to core materials. Calcium hydroxide sealer, soluble may weaken dentin. Glass ionomer sealer, hard to remove in retreatment, minimal antimicrobial effect. The up-to-date root canal sealers are calcium-based, calcium silicate-based bioceramic sealers, and the epoxy resin-based sealers. The calcium-based bioceramic sealers, they have good flow, biocompatible, and you can use it in single cone technique or squirting technique or hot modified technique or bondage obturation technique or hydraulic condensation technique. But in case of epoxy resin based sealer, they have good flow, but they are not biocompatible, and you can use it in single coat technique, or it can do the rapid healing or post-operative no pain. There is no significant idea about that. But in case of latest and cutting edge root canal sealers are Root SP, strontium-based root canal sealer, which is the only one strontium-based root canal sealer in the world. They have the good flow. They have good biocompatibility. You can use it in single cone technique and others, what modified technique and slotting technique, basic hydraulic condensation technique, and bonded obturation technique. And it can do rapid healing, and post-operatively there is no pain or mild pain. Before I go to the highlights of the Root SP, we should know about the osteogenesis and angiogenesis. We all know about osteogenesis. It is a development of formation of bones, but maybe we don't know angiogenesis. Maybe some of you know, but some of may know. Some of is unknown. The growth of blood vessels from the existing vasculature, it occurs throughout the life in both health and disease, beginning in utero and continue on through the old age. The highlights of Root SP bioceramic sealers is outstanding bone healing capacity. Based on the study findings, strontium silicate demonstrate superior efficacy in fostering osteogenesis compared to calcium silicate. Strontium silicate not only promotes osteogenesis but also facilitates angiogenesis, whereas calcium silicate slowly promotes osteogenesis. For cases with apical lesions, Root SP is unparalleled in accelerating bone healing. Its ability to create a strong apical seal, coupled with the osteogenic potential of strontium silicate, promotes long-term healing and ensures a successful outcome. Secondly, the post-operative condition, there will be no symptom or pain, or it might be a mild pain. The paper, there are papers about that. Um, if you want, I can, me or the Root company can provide you the papers. The papers demonstrate the strontium compound possesses the following properties within the dental context. Inhibition of the inflammatory factor TNF, that means tumor necrosis factor, analgesic effects, partial replacement of neural calcium pump function, significantly elevating pain threshold by 10 to 1,000 times. Zero to SP utilizing strontium elements instead of calcium silicate offers strong biocompatibility and helps alleviate inflammation and pain. A recent study found that zero to SP demonstrated superior cytocompatibility in cell proliferation compared to other traditional products. It has got the strong sealability. Zero SP is with strontium silicate demonstrate the ability to deeply penetrate dentinal tubules, generate plate-like strontium doped hydroxyapatite, facilitate mineralization through strontium substitution, establish strong bonds with dentin and obturation materials to minimize voids, and proficiently eliminates microbes, thereby preventing their recurrence. It is highly consistent based on the recent research findings, and notable statistical difference was observed in the middle third of the teeth when comparing obturation techniques with other sealers, except for the zero SP, which stood out by maintaining consistency. This is the suitable difference, suitable of different for different obturation techniques. Previously, I have said that you can do it a single cone technique. That means you can do it bonded obturation technique, hot modified technique, hot modified obturation technique, and spruting technique, and basic hydraulic condensation technique. You can do this kind of techniques, obturation techniques with this sealer. So zero SP empowers a single cone technique with the following advantages: less technique sensitive, shorter procedure time, and potentially less stress to root. Excellent flow. They have got excellent flow. You can see the flowability of the sealer. I have also a lot of cases. If you follow my Facebook page, you can see I'm doing zero. I'm using zero SP, and it's a great flowability. Let's see the video to see the flowability of this product. Now, the superior, it has got superior biocompatibility. According to the publication, the body utilizes strontium to form its own durable bone mineral, and leading to long-term storage in the bone. Over time, as bone undergoes growth, strontium is locally dissolved, circulating through the bloodstream for potential reuse by growing bone or elimination. C-root SBA boasts robust biocompatibility, effectively addressing minor overfilling while seamlessly absorbing excess materials. The overfilling will gone within few days. It will not visible after some day. Easy to observe in radiographically. The radiopacity of C-root SP is superior to that of calcium-based bioceramics. You can see the difference here. This is strontium silicate. This is calcium silicate, and this one is strontium silicate. So strontium silicate exhibits strong biocompatible radio opacity with a bright radiographic contrast. Calcium silicate appears relatively gray with moderate radio opacity. Strontium silicate demonstrates robust radio opacity, providing a vivid radiographic contrast that allows for the clear visualization of the extremely fine root apical bifurcation. So the highlights are outstanding bone healing capacity, post-operative no symptom and pain, strong sealability, highly consistent for different parts, suitable for different obturation technique, excellent flow, superior biocompatibility, easy to observe. Now, there will be some question, how many root canal treatments for 2-gram syringe? It will be 15 to 20 root canal treatments for 2-gram syringe, but I have already used it and not calculated, but I have already did more than 30 canals, 30 or 40 canals with a single syringe. And how long the setting time? 5 to 10 hours. What is the temperature of the heat carrier tip? In single count technique, it will be 150 to 150 or 180 degrees centigrade. But in hot modified compaction technique, it should be 180 degrees centigrade. Why strontium silicate? Because coagulation reaction, when the C-root SP root canal feel in contact with water in the dentinal tubules and on the root canal surface, it solidifies. The coagulation time of C-root SP depends on the degree of moisture in the root canal. In partially dry prepared root canal and canals, and coagulation reaction occurs rapidly. Curing mechanism, the premixed strontium silicate cement solidifies upon contact with water, serving as a sealant for the root canal. After injecting into the root canal, the product absorbs moisture from the dentinal tubules, leading to a chemical reaction and subsequent solidification of strontium silicate and water. Safety. Strontium is an inherent trace element in the human body, primarily stored in the teeth and bones. The human body requires daily intake of strontium elements. What if the overfilling occurs? C-root SP boasts robust biocompatibility, effectively addressing minor overfilling while seamlessly absorbing excess materials. During root canal preparation, it is crucial to safeguard the apical foramen. Any damage to the apical foramen may lead to potential overfilling during the obturation process. While a slight overfilling may be acceptable, it is imperative to avoid penetration into the neurovascular canal. When administering the sealer injection, introduce the sealer into the root canal by placing the injection needle 3 millimeters from the apical foramen. Ensure through distribution of the sealer throughout the middle and upper portion of the root canals. Aim to complete the filling of one root canal before proceeding to inject into the next root. What is the appropriate way to keep C-root SP after opening and using? It is imperative to retain the C-root SP original aluminum plastic bag. Upon completing of the injection, ensure that the cap is tightly screwed back on the sealed, back on and sealed. Then place it into the aluminum plastic bag for storage to room temperature. At room temperature, avoid storing it in a dry cabinet or refrigerator. What is the shelf life of C-root SP? The shelf life is 2 years. Can I use general brand of Gutta Percha with C-root SP? Yes, you can use general brand of Gutta Percha with C-root SP. How does C-root SP set? C-root SP is premixed injectable bioceramic sealer, root canal sealer. C-root SP sets in vivo. Setting begins in presence of moisture from the apical tissue and dentinal tubules. How does C-root SP compare with resin-based sealer? C-root SP offers superior biocompatibility compared with epic resin-based root canal sealers, which may have cytotoxicity. How does C-root SP compare with calcium-based root canal sealers? For cases of apical lesion, C-root SP can better accelerate bone healing, comparing with calcium-based root canal sealers. Unlike certain calcium-based root canal sealers that may cause Soreness post-operatively. C-root SP does not elicit any pain or symptoms after procedure. Unlike certain calcium-based root canal sealers, which exhibits high solubility and contain a small composition of triclinic calcium silicate due to patent issue. C-root SP demonstrate exceptional stability. These are the instructions to use C-root SP bioceramic sellers. Actually, this is the how to do the root canal preparation, and before I obturate, the pre-fill final range moisture absorption, master cone adjustment, sealer injection, master cone injector insertion. What is this is signal cone technique and thermomechanical compaction technique. That means you can say it hot modified technique. Subsequent procedures. These are the instruction for using zero SP bioceramic sealers. These are some clinical cases. This is from the Boston University. They have done this root canal treatment with zero SP bioceramic sealers. If you more clearly closely look, and then you can see the flowability of the sealer. This is from the University of Venezuela, Hong Kong University. C-root, this is a C-shaped root canal filling. Large periapical shadow case, an iatrogenic necrotic case with apical root resorption. This case was done by me. I did that case. There are more clinical cases. If you want, then scan QR code to get related clinical cases. And these are the academic research, C-root related publications. If you want, you can scan the QR code for related publications, or you can directly contact to C-root company. They will provide you the publications because they have the publications with them. And thank you to you all for joining and hear the webinar.